and welcome to A Sound Constitution, here on CHLY 101.7 FM, a show where we focus on health topics that are important to our community. This year's team is made up of 6 VIU nursing students, and our goal is to demystify health issues and address common misconceptions by sharing evidence-informed information from a variety of reliable resources. All information provided on our show will be available in our show notes on our Facebook and Instagram pages. We want to remind our listeners that the information presented in this show is for educational purposes only and does not replace the advice of your primary healthcare professional. If you have questions or concerns about what's being discussed, feel free to reach out to us on Facebook at A Sound Constitution, on Instagram at CHLY A Sound Constitution, or email us at asoundconstitution@gmail.com.
We begin today by acknowledging that we are gathered on the unceded and traditional lands of the Nanaimo people, whose rich cultural history continues to inspire and guide us. Our broadcast also extends into the territories of the Coetsun and the Sliaman nations. We are deeply thankful for the Nanaimo people's enduring connection to this land and for the opportunity to live, learn, and work here today. We make this acknowledgement with a commitment to honor and respect Indigenous cultures, traditions, and histories, and to actively participate in the ongoing work of truth and reconciliation. For more information on the ongoing reconciliation work and land acknowledgement practices of the Nanaimo people, we invite you to visit our Facebook, Instagram, and YouTube pages.
Hi everyone! My name is Brienne, and in today's episode, called Heart of the Island, The Fight for Fair Cardiac Care, we're going to take a closer look at a life-threatening issue right here on Vancouver Island, the lack of access to advanced cardiac care services. Together with my co-hosts, Sophia and Finley, we'll unpack what advanced cardiac care really means, we'll explore how it saves lives, and why patients in Nanaimo and surrounding communities are still being transferred hours away for treatment that should be available locally. You'll also hear from Dr. Forrest of the Fair Care Alliance, learn surprising facts about prevention and recovery, and even discover how something as simple as owning a dog might protect your heart. So stay tuned as we uncover the barriers, the science, and the community voices driving change at the heart of our island. First up, let's hear from Sophia.
Hey everyone! Today I'm going to be talking about heart disease. You've probably heard the term heart disease before, but what does it really mean? Heart disease is a general term that describes several conditions that affect the heart and blood vessels. According to the Government of Canada, coronary artery disease is the most common type of heart disease in Canada, followed by peripheral vascular disease. Let's briefly explore what these terms mean. But first, let's review some of the basics surrounding the cardiovascular system. So, the cardiovascular system primarily involves your heart, your blood vessels, and of course, your blood. Your blood transports different things around your body, but for the purpose of today, we will be focusing on its oxygen-carrying capacity. Your heart is a muscle that pumps your blood throughout your body, utilizing blood vessels. This includes sending blood with no oxygen to your lungs to pick up more oxygen as you breathe it in. When you think of blood going to your heart, you probably think of the exchange between oxygen-rich blood and the blood without oxygen. But your heart has its own blood supply in order to bring the oxygen to your heart so that it can keep pumping. This is accomplished by the coronary arteries and veins. Next, I will go over the most common types of heart disease affecting Canada. First is coronary artery disease. Coronary artery disease is the narrowing of the arteries that supply blood to your heart. This reduces the oxygen that your heart receives. A heart attack, which is also called a myocardial infarction, occurs when one of these coronary arteries becomes blocked. And without oxygen, that part of your heart can become damaged or the cells can die. The second most common type of heart disease affecting Canada is peripheral vascular disease. It is similar to coronary artery disease in the fact that it involves the narrowing or blockage of blood vessels and results in decreased oxygen supply to those areas, Peripheral means that it is occurring in any blood vessel other than the one supplying the heart or brain. It primarily occurs in your extremities, so your legs and arms. The narrowing of the vessels, both in coronary artery disease and peripheral vascular disease, is most commonly caused by a condition called arteriosclerosis, which is the thickening and hardening of the artery walls that makes it harder for blood to pass through. The most common type of arteriosclerosis is called atherosclerosis, in which the arteries become narrow due to a buildup of plaque. Plaque is primarily composed of fatty substances, cholesterol, and cellular waste products. The Government of Canada website recognizes heart disease as the second leading cause of death in Canada. According to the data from the 2017 to 2018 Canadian Chronic Disease Surveillance System, about 1 in 12, or 2.6 million Canadian adults aged 20 and over, live with a diagnosed heart disease. But did you know that heart disease affects certain populations differently? For example, someone who is born genetically male is 2 times more likely to suffer a heart attack than someone who is born genetically female. They are also more commonly diagnosed about 10 years younger compared to someone who is born genetically female, typically between 55 to 64 years of age compared to 65 to 74 years of age for someone who is born genetically female. Every year in Canada, more than 50,000 people die from heart disease. However, on the bright side, these numbers have decreased over the last 20 years. When you compare the data collected between 2000 and 2001 with the data that was collected between 2017 and 2018, the number of Canadian adults newly diagnosed with heart disease has declined from 217,600 to 162,630. The death rate, or number of deaths per 1,000 individuals with known heart disease, has decreased by 21%. Data from the Canadian Chronic Disease Surveillance System indicates that the rate of certain types of heart disease and conditions in BC differ from the national average. Data from 2023 to 2024 indicates that in British Columbia, 912 people per 100,000 have coronary artery disease, while in Canada overall, the rate is only 622 people per 100,000. However, for heart attacks, the number per 100,000 in BC is 156, while in Canada overall, the number is 193 per 100,000 people. To find out how to decrease your chances of developing heart disease, stay tuned. Later in the episode, Finley is going to be exploring lifestyle changes and other ways that you can keep your heart healthy. If you would like to learn more about heart disease, its occurrence in Canada, or to check out the sources used in today's episode, please check out our show notes on Facebook or Instagram at A Sound Constitution.
Wow, I had no idea cardiac health was such a major factor in Canada. Thanks for sharing, Sophia. Now, I'd like to contrast our heart health with a different demographic, the indigenous Jimene people. Let's take a look. The indigenous Jimene people of Bolivia live a traditional hunter-gatherer and farming lifestyle, and they have some of the healthiest hearts ever studied. In a recent study published in The Lancet, cardiologist Dr. Randall Thompson calls them the population with the least coronary atherosclerosis ever reported. Even elderly Jimene people have arteries similar to those of someone decades younger in the US. According to Dr. Randall's study, an 80-year-old Jimene has a vascular age comparable to that of an American in their mid-50s. In Dr. Randall's study, he found that 85% of Jimene adults had no coronary artery calcium, or CAC, meaning no detectable plaque in their arteries, and only 3% had any significant coronary artery calcium. Even for those over the age of 75, 2/3 of those in the study had no coronary artery calcium, and just 8% of those in the study showed elevated levels of coronary artery calcium, a rate 5 times lower than that of the US population. In short, true coronary artery disease is exceedingly rare in this group. The Jimene have extremely low levels of the usual heart risk factors. Their average LDL or bad cholesterol is extremely low, and they usually have enough HDL or good cholesterol. Obesity, high blood pressure, high blood sugar, and smoking are all very uncommon. Few Jimene are overweight, and blood pressures are usually pretty low, even into old age. Cigarette use is rare. Only about 28% of those in the study reported any smoking at all, and those who did usually smoked just 10 cigarettes per month on average. Essentially, many Jimene go a lifetime without the classic lifestyle risk factors that plague industrialized societies. Additionally, the Jimene people live in small villages, foraging, farming, fishing, and hunting daily. Physical activity is built into life. Men spend about 6 or 7 hours per day and women 4 to 6 hours a day in moderate to vigorous activity. An average hunting trip lasts over 8 hours and covers 18 kilometers in the forest. Their diet is unprocessed and high in fiber, with an estimated 72% of calories coming from carbohydrates like plantains, corn, and wild fruits. 14% come from proteins like wild game and fish, and only 14% come from fats, mainly from fish. They eat almost no trans fat or processed sugar and only about 11 grams of saturated fats per day on average. This high fiber, low fat diet and constant activity are believed to be major protective factors for the heart. One surprising aspect is that the Jimene people have high markers of inflammation. Over 50% of those in the study have elevated C-reactive protein, which is an inflammation marker, likely due to widespread infections. They lack clean water and sanitation, with about 66% carrying intestinal parasites at any time, and common infections like parasites and tuberculosis keep their immune systems activated. Chronic inflammation is usually a risk for heart disease, yet despite persistent infections and high inflammation, their arteries stay clean. Dr. Randall and their team speculate that the Jimene's lifelong low cholesterol, healthy blood pressure, and active lifestyle override this inflammation risk. Now let's look a little closer to home. According to the 2017-2018 data from the Canadian Chronic Disease Surveillance System, about 1 in 12 Canadian adults aged 20 and over lived with diagnosed heart disease. And every hour, about 14 Canadian adults aged 20 and over with diagnosed heart diseases die. We could really learn a thing or two from the Jimene people. A little bit of movement and some good food goes a long ways. Thanks for joining me, and make sure you stick around, because there's more to come.
Thanks, Finley. Now let's dive back into some important information about cardiac-related treatments. Over to you, Sophia.
Since we covered some of the most common types of heart disease in Canada and what those conditions look like, now I would like to go over some of the cardiac care and treatments that are needed to address them. First off is an angioplasty. The Mayo Clinic gives a nice overview of the procedure from start to finish. This procedure involves cardiac catheterization, which is when a very thin and flexible tube called a catheter is inserted into an artery, typically in the wrist or the groin, and then gently guided towards the artery that they are trying to reach. This is accomplished using an X-ray so that the doctor can watch the catheter as it travels towards the target vessel. Once they have reached the target vessel, the doctor will inject a special dye that they are able to see on the X-ray. This allows them to see how blood travels through the artery. Then the doctor will insert a balloon-tipped catheter. Once the balloon tip is in the right position, they will inflate the balloon, sometimes multiple times, in order to relieve the blockage. Oftentimes, they will also insert a permanent stent. A stent is a mesh tube that holds the vessel open and prevents it from narrowing after the procedure. They then remove the catheter and apply pressure to the area that it was inserted. All in all, this procedure usually takes between 30 minutes and 2 hours. The second is called a coronary artery bypass grafting, or CABG. This is the most common type of heart surgery for adults. A CABG treats the narrowing of the coronary arteries by bypassing the portion that is blocked using a graft. This is done using a healthy blood vessel from somewhere else in the body and attaching it in two places, one end to the supply side and the other end to the demand side. This allows the blood to reach its target by creating an alternate route to travel. CABG is a more invasive procedure that involves accessing the heart through the chest. Sometimes, in order for the surgeon to attach the new vessel, it requires them temporarily stopping your heart. Doing this requires a bypass machine. A bypass machine is a special machine that is attached to the vessels surrounding your heart, rerouting the blood into the bypass machine. Then the machine will temporarily pump your blood while the surgery is being performed. In other cases, the surgeon is able to complete the surgery without the need to stop the heart, and thus a bypass machine is not necessary. We've covered quite a bit surrounding coronary artery disease and the relationship to heart attacks, but now I'd like to take a moment to talk about two terms that you may have heard before but may not understand what they mean: NSTEMI and STEMI. NSTEMI stands for non-ST elevation myocardial infarction, and STEMI stands for ST elevation myocardial infarction. But what does this mean? Let's break down these terms. As we mentioned earlier, myocardial infarction is the medical term used for heart attack. The ST elevation and non-ST elevation refers to the interpretation of the electrical impulses of the heart rhythm that can be seen during cardiac tracing. This is also known as an electrocardiogram or ECG. This is what is seen as the well-recognized heartbeat line. Each part of this can be broken down into different parts that correspond to how well the heart is functioning. But for today, we just need to know the ST segment. In non-ST elevation myocardial infarctions, there is no typical elevation of the ST segment seen like in other types of myocardial infarctions, like STEMIs. But what does this mean? What's the difference? Well, it comes back to the coronary arteries, and if they are blocked completely or not. In an NSTEMI, the blood flow to the heart is only partially or temporarily blocked. However, in a STEMI, the blood flow to the heart through the affected arteries is completely blocked. If you would like to learn more about anything covered here today, please check out our show notes on Facebook and Instagram. You're listening to A Sound Constitution on CHLY 101.7 FM.
Hey again, everyone. Today I'm joined by Dr. David Forrest. He's a specialist in infectious disease and critical care, the president of the Medical Staff Association, and a member of the Fair Care Alliance. Dr. Forrest, thank you so much for taking the time to join me today.
Thank you. Happy to be here.
To start us off, could you tell us a bit about who the Fair Care Alliance is?
Yes, it's a coalition of community groups as well as the Medical Staff Association. So it includes business people, municipal government. The Indigenous representation is by Chief Weiss of the Snuneymuxw First Nation, as well as philanthropic leaders are the chair of our Nanaimo Regional General Hospital Foundation, regional leaders, business people. So it's a coalition largely of community groups that is dedicated to ensuring that we have fair, more equitable access to healthcare services for those living north of the Malahat.
So it sounds like there's actually a lot of different voices coming together, not just from healthcare, but from the wider community too. So you mentioned that the main goal is improving equitable access north of the Malahat. Could you talk a little bit more about why the Fair Care Alliance was formed in the first place?
Well, the primary purpose of the group is in order, as I say, to ensure more equitable service access for those living in Central North Island. Indeed, about half of the population, actually close to 60% of the population on the island lives north of the Malahat, but really about a third of the healthcare resources expended are spent on residents, are available to residents locally north of the Malahat. So the Fair Care Alliance, or its purpose, is really to advocate for development of more equitable access to service for those of us that live north of the Malahat, which has been a problem. And initially, the intent was to ensure that we had a promise and commitments to a new tower for patients that would provide those services. and that was its initial job, but that job is not finished yet. So that's why it's still going strong.
For sure. It's hard to believe that such a large part of the island, 60%, as you said, still has so little access to care. What would you say are maybe some of the key health services that are still missing here in Nanaimo?
Well, there's many tertiary level services that we really require locally. And there has been some movement over the years towards that. In the 21 years that I've been in Nanaimo, we have an established tertiary level intensive care unit. We have a nephrology program, which is a tertiary level service. And we are now getting a cancer agency. But really, to support a cancer program, we also need far more tertiary level services. We have only one gastroenterologist. We have inadequate psychiatric services. We only have 2 to 3 neurologists, and we have no cardiology service. So we're sadly lacking in most tertiary level services, which the citizens north of Malahat really require locally and can't access readily in Victoria. And as we develop services like a cancer program, it's a desperate need.
Yeah, it's really surprising that a region this large is still missing so many essential services. It really goes to show how interconnected all of these specialties are. Especially with the new cancer program coming. And without those supports that you mentioned in place, the system simply can't function the way it's meant to. So I guess my next question is, who actually decides which health services get developed in Nanaimo? Or I guess maybe a better way to phrase it is, who's dropping the ball at the government level?
Well, that's a complex question to answer in some respects. First off, many of these services are led on a regional basis. So, for example, divisions of gastroenterology, neurology, cardiology are island-wide divisions. And so at that level, there is a responsibility by the divisions or departments to ensure equitable delivery of services. Island Health, though, is primarily responsible for ensuring equitable access. So the board is appointed, and the Island Health Administration is hired by the board in order to do that job. At the end of the day, fundamentally, in order to fund programs, that requires governmental approval. And that obviously requires several levels of government at the municipal level as well as provincially, and several different departments. Oftentimes where infrastructure is required, it's not just simply the health ministry, but it's the Ministry of Infrastructure, but also obviously because of financial impacts involves the Ministry of Finance. So there's a whole lot of layers that are responsible for ensuring equitable delivery of services. At the end of the day, it is principally Island Health's responsibility.
Interesting. Well, thank you for clarifying that. It really just goes to show how many layers are involved in all of these decisions. But I guess it also makes sense why accountability can get so easily lost in that process with so many different ministries and agencies involved. It's no wonder the public struggles to know who to turn to when things start to stall. And for people living here, that lack of clarity can be extremely frustrating, especially when we're the ones that are feeling the impact of these delays. So I guess with that in mind, how can people in the community get involved or push for the changes that are so clearly needed?
Well, I think there's several things. First of all, the Fair Care Alliance has generated a petition that we hope will be presented in the House at some point. That petition is still available to sign. We've collected tens of thousands of signatures. That, I think, is an important recognition by the community of the importance of developing those services. The second thing I think is becoming more active, particularly through an advocacy group like Fair Care Alliance. I would also encourage patients who feel that they have not had access to service to talk to Island Health directly. That is a say, it's Island Health that's principally responsible for delivery of services. And if they have had problems accessing it or they feel that they have been wrong, they should be talking to Island Health about that. So there's things that they can do. And I think finally, of course, writing to and communicating with MLAs and Mr. Eby.
Of course, yeah. Well, it's great to know about all of these things that people can do to help. It feels like so much of the time these decisions are completely out of our hands, so it's encouraging to hear that community voices can still make a difference. So, before we wrap up, is there anything else you'd like to add or touch on while I've got you here?
Well, I think the important thing to understand, Brianne, is, as I mentioned earlier, one of the things that's been advocated for is a new patient care tower. Now, a new patient care tower in Nanaimo is desperately needed simply because the infrastructure is now 63 years old. It is too small for the patients that we have. We have nominally 354 beds and generally run 20% over capacity. So patients are being managed in broom closets and hallways. So we also have a dilapidated infrastructure that it is very difficult to renovate because of issues with the electrical grid and plumbing, etc. So we need a new infrastructure for sure. But the main reason that we need a new tower is because we need expanded services. And so I think it's important to understand that the advocacy for a new tower is really a metaphor, if you will, for the advocacy for the development of the needed tertiary level services in Nanaimo. And we need that desperately. I think it was recognized in 2010, and here we are 15 years later, and we're nowhere near to getting that even approved. I think the second thing that's important to emphasize, Brianne, is that of the tertiary level services that are needed in Nanaimo, the most pressing is the need for cardiology services, and most particularly the development of cardiac catheterization. That is critical because patients who have heart attacks, have unstable, poor blood flow to the heart, need access to that service locally. They can't wait to get down to Victoria. They need to have it here. And if we have that here in Nanaimo, we can provide that service for a much larger population in terms of immediate access than they possibly can in Victoria. So that's desperately needed. And that need has been recognized, frankly, for 20 years. And there's been a failure to act, a failure to provide that service. And patients are suffering. They develop heart muscle damage as a result of suboptimal treatment for their heart attacks, and they die as a result of the lack of immediate access to this service. So it is absolutely desperately needed. And the position that Fair Care and the medical staff has taken is that this service is required within 3 years. We can't wait any longer. So I think that's a really important thing to emphasize for the public, that we are advocating for development of services, not just a new tower, not just new infrastructure to replace the old one, but rather new expanded services to serve the population, not frankly just of Nanaimo, but of all of Central North Island.
Yeah, those are some really excellent points. And you're right. The fact that these services are still not in place, especially when it comes to cardiac care, it's honestly hard to believe, and it's truly unacceptable.
Well, it is. And, arguably much of that it can be said as inconvenience. But when it comes to issues like heart attacks, it's life and death. It's not just an inconvenience having to drive down to Victoria. It actually is something that results in morbidity and mortality to patients. And from our standpoint, it is no longer acceptable that there be inaction on the development of cardiac catheterization services. From our standpoint, this needs to happen now.
Absolutely. And delays like this have real consequences. I think that's why the Fair Care Alliance's call for these services to be in place within the next 3 years feels so critical, because patients simply cannot wait any longer.
Yeah, I think one other thing just to mention on that front, and I don't know, Brianne, if you saw the meeting that was held, I guess, a week and a half ago now in a News Bay. But one of the things that has been emphasized is that all of the residents of the regional district of Nanaimo, through our property taxes the last several years, have been contributing to a health infrastructure fund that has now accumulated $100 million. And the cardiac catheterization laboratory is recognized as such a priority for the community that the regional district of Nanaimo is willing to put all of the money up front to build it, so that there's no money that's expended up front by the provincial government in order to move this forward. That is the commitment of the community. There are donors that are pouring literally millions of dollars into a cardiac catheterization lab through the NRGH Foundation, even when none exists. There's no promise for one, there's no campaign for funding. The level of concern in the community is huge, and the commitment is great. So yes, we are determined that we will get patients the care that they need.
Yeah, that is an incredible show of commitment from the community. I mean, not just raising funds, but willing to invest them up front to get this moving. It really just shows how strongly people feel about this issue and how determined they are to see real change happen.
Yes, yeah, exactly. And I think that is a big thing. I think that although the Fair Care Alliance represents leaders within the community, it frankly represents a huge community movement in advocating for better health care for the community here, but as I say, across Central North Island.
Absolutely. And I have to say, it's super inspiring as both a future nurse and a current member of the community just to see how many people are standing behind this cause. So, again, thank you so much, Dr. Forrest, for sharing your insight and for all of the advocacy work that you and the rest of the folks at Fair Care Alliance are doing for our region. It's abundantly clear how much passion you have for this issue, and I really appreciate you taking the time to share it with us today.
Thanks very much. Anytime, Brianne, anytime. All right, take care.
Thank you. You as well. Bye-bye.
Bye-bye.
Once again, that was Dr. David Forrest of the Fair Care Alliance, and you're listening to A Sound Constitution on CHLY 101.7 FM. Up next, let's hear from Finlay about preventative cardiac care.
Good afternoon, good afternoon. Today we're having a heart-to-heart about preventative cardiac care. Heart disease might not be something we think about every day, but it affects many of our friends and our neighbors over time. The good news? There's a lot we can do to keep our hearts healthy and strong. In this special segment, we'll explore what preventative cardiac care means, why it matters, and some of the challenges people face here in Nanaimo. So grab a water bottle or maybe lace up your walking shoes and let's get started on this road to a healthier heart. When we talk about preventative cardiac care, we mean taking action before heart problems occur. It's about living in a way that keeps your heart and blood vessels healthy over the long run. So why does this matter so much? Well, heart disease is a big deal. According to the Canadian government, it's actually the second leading cause of death in Canada. That means many of us have lost loved ones to heart attacks, heart failures, or strokes. But importantly, many of these illnesses develop slowly and can be prevented or delayed with healthy choices. So how does heart disease develop over time? Often, it's due to a buildup of plaque in your arteries, a gunky mix of cholesterol and fats that narrow the blood flow to your heart. Think of pipes getting clogged. Over years, things like unhealthy diet, smoking, high blood pressure, or cholesterol can slowly clog the arteries. Eventually, that blockage can cause a heart attack or heart failure if you don't intervene. The process is sneaky, and you won't feel plaque buildup. That's why doctors emphasize prevention, taking care of risk factors now so problems don't sneak up on you later. The great news is we have control over many of these risk factors. Preventative care can be as simple as creating everyday habits. According to the Canadian government, being smoke-free, staying physically active, eating a balanced diet, keeping a healthy weight, and moderating alcohol all can dramatically lower your risk of heart disease. Even managing stress and getting enough sleep help your heart. And if you have medical conditions like high blood pressure, diabetes, or high cholesterol, catching them and treating them early makes a huge difference. In short, small lifestyle changes add up to big heart health rewards. You're never too young or too old to start taking care of your heart. Think of it this way. Preventative cardiac care is like maintenance for your car. You change the oil and you check the tires to prevent breakdowns. For your heart, that means regular checkups, an active lifestyle, and healthy food to prevent health breakdowns later. And just like a trusty car, a well cared for heart will serve you better and longer. So preventative care, it's not just about scary doctor visits. It's about empowering yourself with healthy habits each day. Now, let's get real. If healthy living were easy, everyone would do it. What barriers make prevention harder, especially here on the island? Gym membership and fitness classes can be pricey. Not everyone can afford a monthly gym fee or fancy equipment. This financial barrier can discourage people from staying active. If you're on a tight budget, paying $50 or $100 a month for a gym pass might be out of reach. It's important to remember, though, you don't need a gym to exercise. Free options like walking or home workouts can also help you stay active. Eating healthy is also tough when you can't reliably get access to good food. Sadly, according to the Food Security Action Guide, about 1 in 10 people on the Vancouver Island region are food insecure, meaning they're not sure when they can get their next healthy meal. Healthy food like fresh produce or lean protein can be more expensive or hard to find, especially if you live farther away from grocery stores. Food insecurity leads to reliance on cheaper processed foods that are often high in sugar, salt, and unhealthy fats. That's a recipe for higher risk of heart disease over time. This is a real concern for many families in Nanaimo who are struggling with a rising cost of living. Additionally, having a family doctor or a nurse practitioner is a key part of prevention. They check your blood, monitor your cholesterol, and give tailored advice. However, right now, according to the Nanaimo Hospital Foundation, thousands of people in the Central Island area, that includes Nanaimo, can't find a family doctor due to physician shortages, long walk-in clinic wait times, or having to use the ER for non-emergencies have become common. Without regular checkups, treatable issues like high blood pressure or early signs of heart disease might go unnoticed. This gap in primary care is a big barrier to preventative health. And not everyone has a car or access to convenient public transit to go out to health programs, grocery stores, or appointments. Our region is spread out. If you live outside the city center or have mobility issues, simply getting to a gym, a healthy food market, or a doctor's office can be difficult. Transportation barriers often lead to missed appointments or skipped workouts. In fact, research published in the journal Community Health shows that lack of transportation leads to missed medical visits and delays in care, resulting in worse management of chronic conditions. Beyond personal choices, factors like income, education, and social supports have a huge impact on heart health. People with lower incomes often have the highest rates of heart disease. In fact, those with the lowest income generally experience the poorest health, and with each step up in income, health outcomes improve. It's not that wealth causes health, but financial stability can mean better housing, ability to buy healthier food, leisure time for exercise, and less chronic stress, all of which are protective for the heart. Education matters as well. Understanding nutrition labels or the importance of exercise can help people make informed choices, and feeling connected in the community helps. If you have friends to walk with or cook with you, you're more likely to stick to healthy habits. These broader social factors are often called the social determinants of health. In Nanaimo, like elsewhere, folks facing poverty, insecure housing, or social isolation often have a harder time prioritizing long-term health when their immediate needs like rent or their safety still need to be met. Recognizing these barriers is the first step in addressing them. It's a lot of challenges, I know, but Nanaimo is a caring community, and there are efforts to help overcome these hurdles. And make sure you stick around, because next up, Sophia takes us through your plan of action if you think you're having a cardiac event, the crucial steps that may just save your life.
We've talked a lot today about heart disease and cardiac conditions. But what do you need to know in order to respond in the event of a cardiac emergency, either for yourself or for another person? I'm going to cover what you should do if you think you or someone around you is having a cardiac emergency. We're going to focus primarily on heart attacks. It is important to remember that this information is for educational purposes only and should not replace the advice of your primary care provider or medical professionals. First, let's go over the symptoms that you may experience if you are having a heart attack. This list is from the Mayo Clinic. You may experience chest pain that might feel like pressure, tightness, pain, squeezing, or aching. You may experience pain or discomfort that spreads to your shoulder, arm, back, neck, jaw, teeth, or sometimes your upper stomach. You may experience cold sweats, fatigue, heartburn or indigestion, lightheadedness or sudden dizziness, nausea, or shortness of breath. A heart attack usually causes chest pain that lasts more than 15 minutes. The chest pain may be mild or severe, and some people don't have chest pain or pressure. Symptoms may be less obvious in some people, especially for women, but we'll cover more on that later. Some heart attacks happen suddenly, but many people have warning signs hours or days in advance. So, what do you do if you think you're having a heart attack? The first thing you should do if you or someone around you is having a heart attack is to call 911. Even if you are unsure, it is better to be safe than sorry. And do not attempt to drive yourself to the hospital. This can put you in further danger, as well as potentially harming someone else. If you are alone, try to get to a safe area with other people so that if you lose consciousness, someone else will find you and be able to help. This can include going into a common area of your house where your family or roommates are, or if you live alone, going outside of your apartment or home. The important thing to do is to make sure that you are somewhere safe and not putting yourself in danger. Another thing that you can do is take aspirin, so long as you haven't been told not to by your primary care provider. Aspirin helps prevent the blood from clotting. This could be beneficial in reducing the damage to your heart in the event of a heart attack. This should only be done on the advice of a healthcare professional. Another option for someone with a pre-existing heart condition involves taking a dose of nitroglycerin. This should only be done by people who have a prescription for nitroglycerin and have been instructed in how to self-administer it by their primary care provider. A heart attack is a serious emergency and may result in the person needing to receive CPR. If the person does not have a heartbeat or pulse or is not breathing, they will need to receive CPR. If you are trained in CPR, you should begin giving chest compressions and providing rescue breaths if you are comfortable doing so. If you are not trained in CPR, but are comfortable trying to provide CPR, you should put both hands firmly on the person's chest and push down at a rate of 100 to 120 pushes per minute. AEDs, or automated external defibrillators, can be used in the event that someone does not have a heartbeat and is unconscious. AEDs are programmed to provide step-by-step instructions for use as soon as they are turned on. AEDs will deliver a shock to the heart in order to correct the rhythm and hopefully start it beating normally again. The AED will only deliver shock if it detects that one is necessary. So if one is available, it is safe to use. The most important thing to remember is if you think you or someone around you may be experiencing a heart attack, call 911 immediately, because every second counts.
You're listening to A Sound Constitution on CHLY 101.7 FM. When it comes to heart disease, many of us picture one story: someone clutching their chest in pain. But here's the truth. Heart disease doesn't look the same for everyone, and different bodies tell very different stories. That's right. According to the Heart and Stroke Foundation, heart disease can appear differently depending on factors like sex, hormones, and anatomy. For example, people assigned female at birth are more likely to experience a type of small vessel disease called microvascular disease, which affects the tiny blood vessels of the heart, rather than the major arteries. Because of this, their symptoms don't always match the textbook picture. Instead of the classic crushing chest pain, the Heart and Stroke Foundation notes that people with microvascular disease may feel chest discomfort, shortness of breath, fatigue, indigestion, nausea, or pain in the back or the neck. These quieter signs are easier to brush off, and that can be dangerous. Even when people do seek care, diagnostic tests like angiograms or treadmill stress tests aren't always as effective at detecting small vessel disease, meaning important problems can sometimes be missed. But there's more. Research shows that people assigned female at birth are less likely to be prescribed medications after a heart attack, such as blood pressure or cholesterol-lowering drugs, and less likely to attend cardiac rehabilitation, even though rehabilitation programs lower the risk of future heart events and improve quality of life. Hormones also play a role across the lifespan. Pregnancy, menopause, and hormonal changes all can affect cardiovascular health. For trans women, gender-affirming hormone therapy may increase the risk of stroke, blood clots, or heart attacks, which makes regular monitoring and follow-up care especially important. Trans men and non-binary people may also face a unique risk depending on hormone use, surgical history, and access to inclusive healthcare. Systemic inequities compound these risks. Many Indigenous communities in Canada experience higher rates of heart disease and stroke, often linked to barriers in accessing care, nutritious food, and clean water. People of South Asian, Chinese, and Afro-Caribbean descent also have higher rates of hypertension and diabetes, which are key risk factors for heart disease. So, what does this all mean? It means that when we talk about heart disease, we need to broaden the picture to include every kind of heart and every kind of story. Heart symptoms may be quieter in some people, but their message is just as urgent. Paying attention to shortness of breath, unexplained fatigue, or an ache in your jaw or back is essential, as it could be your heart asking for help. Awareness saves lives. The more we recognize differences in biology, hormones, and access to care, the better we can protect every heart. So don't ignore what your body's trying to tell you. Ask questions, advocate for yourself, and remember that cardiac rehabilitation, healthy living, and community supports are key parts of recovery and prevention. Because every heartbeat tells a story, and every story deserves to be heard.
Thank you, Finley, for highlighting the different types of heart attack symptoms. It's so important to know what to look for, especially if it looks different from what we've typically seen in TV and movies. Now, it's time to hear all about the secret connection between heart health and dogs. Take it away, Sophia.
Hello, everyone. Did you know that owning pets, specifically dogs, has been shown to improve cardiac health? Theories surrounding overall health and pet ownership have been around for a long time, but there's emerging studies showing that owning dogs can positively impact your cardiac well-being. A 2016 literature review published in Current Cardiovascular Risk Journal explored the relationship between pet ownership and recovery after cardiovascular events. Some of the earliest reports relating to health benefits of companion animals have been in patients who have survived coronary artery disease. A study by Friedman et al. Looked at the effects of social isolation and social support in a group of 92 survivors of myocardial infarction or angina. And they found that among pet owners, the 1-year survival rate was 94% as compared to 72% among those who were not pet owners. The authors found that the benefits of pet ownership extended beyond physical activity among dog walkers, and attributed the reduced mortality to emotional effects of companionship with associated improvement in depression. An article by the American Heart Association, titled, "Here's More Evidence Your Dog May Lengthen Your Life," identified dog owners as being 31% less likely to die from cardiovascular-related issues, and 65% less likely of dying following a heart attack. These statistics are based on a study that was conducted in Sweden with a focus group of 182,000 people, some dog owners, some not, after they had experienced a cardiac event. So even though there is an association being drawn between dog ownership and improved cardiovascular health, it is important to note that owning a dog is a big undertaking and should not be considered purely for personal health reasons. Someone who is thinking of owning a dog should ensure that they can provide a healthy, safe, and nurturing environment for that dog. Improving your own health is just one of the many benefits that owning a dog happens to have. So, at the end of the day, owning a dog can improve your health far beyond just increasing your physical activity. It also improves emotional support and increases social involvement. If you would like to learn more about the topics discussed here today, please check out our show notes on Facebook or Instagram at A Sound Constitution. Thanks for listening.
Wow, I had no idea that my fluffy friends could have such an impact on my health. All the more reason to love them. If you just had a heart surgery or a cardiac event, a fluffy friend might be exactly what you need to help with the recovery process. But together, let's go over what other steps we can take to make sure that we recover the very best we can. If you or someone you love has had a heart attack or other cardiac event, you know that recovery doesn't end when you leave the hospital. That's where it truly begins. Many things can change once you get home. You might feel more tired than you expected or need a new daily routine to manage medication and rest. Your diet, activity level, and even your family roles may shift for a while. It takes time to recover and learn to live with coronary artery disease. According to Vancouver Coastal Health, it's normal to feel a mix of relief, worry, and frustration in the weeks that follow. Keep in touch with your healthcare team. Before leaving the hospital, make sure you have a contact number for questions and book a follow-up with your family doctor within a week or two. If you notice symptoms like worsening chest discomfort, dizziness, or shortness of breath, call your doctor or 911 right away. Emotional recovery is just as important as physical recovery. Vancouver Coastal Health emphasizes that low moods, anxiety, or fear of another heart attack are common, and support from loved ones or professionals can make a huge difference. Share how you're feeling and let others know what kind of help you need and what you can do yourself. Staying socially connected, even through phone calls or emails, helps reduce stress and supports healing. The Heart and Stroke Foundation notes that recovery experience differs across sex and gender. Women often juggle caregiving roles while recovering, while men may struggle to accept physical limitations. Trans women taking gender-affirming hormone therapy face increased cardiovascular risks and need ongoing follow-up care. There's no right or wrong way to cope. The key is to stay engaged in your recovery and reach out for support early. One of the most effective tools for recovery is cardiac rehabilitation. According to the Heart and Stroke Foundation, cardiac rehab is a medically supervised program that includes safe exercise training, education about heart-healthy living, and counseling to reduce stress to help you return to an active life. These programs, often lasting around 12 weeks, have been shown to improve quality of life, prevent future heart problems, and reduce the need for hospital readmissions. You may be able to return to your normal activities within a few weeks if you don't have chest pain, discomfort, or any other complications. Many people can start walking right away, and there are several walking groups located in and around Nanaimo that can help out with motivation. Talk with your doctor about curating a safe plan for returning to your routine, including when to drive, go back to work, or engage in sexual activity. According to the Heart and Stroke Foundation, most people can safely resume sexual activity once they can climb 2 flights of stairs without chest pain or shortness of breath, usually within about 2 to 8 weeks after a cardiac event. Vancouver Coastal Health adds that it's important to wait until your energy and comfort levels have returned and to choose positions that don't strain the chest or require heavy arm support. Always talk with your healthcare provider before resuming sexual activity to make sure it's safe for your specific recovery. Vancouver Coastal Health reminds us that walking every day helps your heart, circulation, and mood, and most people can start a structured cardiac rehabilitation program within 6 weeks of their cardiac event. Returning to work is an important milestone. Most people can go back between 1 and 3 months after leaving the hospital. Starting with shorter shifts and building up gradually makes it easier on your heart and your mind. Take your medications exactly as prescribed. The Heart and Stroke Foundation outlines several types like ACE inhibitors, beta blockers, statins, and blood thinners that reduce strain on your heart and help to prevent new blockages. Never skip or change doses without talking to your doctor. And beyond medication, lifestyle changes are powerful medicine too. Eat a heart-healthy diet that's low in salt and saturated fat. Quit smoking if you smoke. Manage stress through breathing exercises, meditation, or spending time outdoors. And stay active. Even 10 minutes of walking a day can help your heart grow stronger. Once you've had a cardiac event, your risk of another increases. But with care, that risk can drop dramatically. Cardiac rehabilitation and community programs help you rebuild not only your heart, but also your confidence. Recovering from a cardiac event isn't about going back to who you were before. It's about becoming stronger, wiser, and more in tune with your body. And you're not alone. Here on the island, programs like Take Heart and Breathe Well and Heart Matters offer supervised exercise, education, and emotional support to help you move forward. Make sure to check out our show notes for links to their websites and for more information on anything we've talked about today. Take it one day, one heartbeat at a time. Your heart has already proven its strength, and now it's your turn to nurture it.
And that concludes this episode of A Sound Constitution. Today we took a closer look at cardiac health on Vancouver Island, from the warning signs of a heart attack to the importance of timely treatment and prevention. We also heard about the local barriers to advanced cardiac care, learned what's being done to advocate for change through the Fair Care Alliance, and explored everyday practices to keep our hearts healthy. Thanks so much for listening to our show today. For details and show notes, including our references, check out our Facebook page at A Sound Constitution on 101.7 FM, or our Instagram at CHLY A Sound Constitution. We want to remind our listeners one more time that the information presented in this show is for educational purposes only and does not replace the advice of your primary healthcare professional. If you have any questions or concerns about what was discussed today, please feel free to email us directly at asoundconstitution@gmail.com. And if you missed any of this episode or want to check out our other episodes, you can head over to our YouTube channel or our Spotify page at, you guessed it, A Sound Constitution. Thanks again for listening, everyone, and we hope you all have a wonderful rest of your day.